Hi, this is Chris Johnson at Johnson Oral Facial Surgery in Dallas, Texas. Today I wanted to talk about all-on-4 or full mouth implants. They're called a bunch of different things. Teeth in a day, all-on-X, digital workflow implants. These are all different names to describe the same thing, where somebody comes in either with failing teeth or no teeth at all, and we're actually recreating the entire arch of teeth that are supported or built on implants. This has revolutionized the way people can function. Used to, when people had their teeth removed, it was a huge change in their lifestyle. It created very difficult pattern of eating. It was difficult to articulate words. All these things have improved drastically with the invention of dental implants. And so what I want to do is I want to first talk about how we do our work process here at Johnson Oral Facial, what to expect as far as recovery and post-operative period, and just also at the end, I just kind of want to give you some guidelines or some questions to ask your surgeon when you're going in, or your team when you're going in, and asking them about how they do it at other offices. First thing, on your initial visit, it's merely just a kind of meet and greet. We're trying to figure out what you desire, what you want to accomplish, answer questions about the procedure itself. There's lots of different variations to the procedures that we do. Everything is custom made and tailor made to you. And this appointment's for you. It's not for us. The second appointment, let's say you go home. We want you to think about this. This is a big decision. This is a life-altering decision in a positive way. And we want you to have time to reflect on it and to think of any more questions. The second appointment is kind of a records appointment. You'll come in, we'll gather lots of information. We'll get a cone beam CT scan of your face, a 3D facial scan. We'll then merge that with a digital impression using our Trios scanner. We'll do lots of measurements to see where the position of the teeth, the size of the teeth, the shape of the teeth, where to position it within your jaws, how to make and how wide to make the arch and the smile, to recreate all these different variables. We'll be taking photographs during that time as well. We'll then compile all this information. I'll merge all the digital files. Everything I do is a digital workflow. This expedites things in communication between the lab and the restoring dentist or the prosthodontist and the surgeon. It also guarantees just accuracy. The way that we're planning this, everything is planned towards you. It's planned off of your CT scan. It's planned off of your digital files. Everything is custom made. So there's not any stock abutment. What is made and measured for you is not going to be the same that I use for a different patient. Once this planning period takes place, usually it takes me about a week or so to process everything. We will actually go in and print off guides, a 3D printer. We'll print off guides. We'll actually mill out your temporary dentures, and then we will use that on the day of surgery. So when you come to see us on the day of surgery, you won't have anything to eat or drink, and you'll need somebody to bring you home because we're going to put you to sleep to do this in our surgical suites. The typical case takes me about 2.5 hours to do. We will either extract the remaining teeth, smooth everything, prepare it, put the implants in. And then at that time, we're going to use a new technology called photogrammetry. This is a newer technology not many people are using. This is going to capture the exact position of those implants. I used to do it in a different way where it was still digital, but we would actually put the temporaries in that day where you'd walk out of the office that day. That worked very well. This way is even more precise because this information that captures the exact positions of the implants is then digitally transferred to our lab. Then they spend overnight milling a new temporary that fits perfectly in the new positions of the implants. You will come see us the next day, and we will put in the temporary teeth, whether it's just the top or the bottom or both the top and bottom, we will insert them. During the next phase, so about 3 months, you'll be wearing these temporary teeth that are fully attached to the implants. You will then have to kind of recreate how you get used to the teeth, really, and figure out if you like the way that they're shaped, like the way that they look aesthetically, and kind of make notes of any changes you want to with the permanent teeth. It's a red flag when people want to say, yes, they want to walk out the next day or that day with their permanent teeth. You don't want that at all. You want to get used to, make changes. You're going to live with these teeth. They're an investment. You want to be able to adapt to them. And if there's any changes that need to be made, you want to do that after you've had some time kind of trying them out. After 3 months, you'll come to our office. We'll take some more impressions and another scan. We'll then send that data off to our lab, and then we will get the final set of teeth based off of your options or preferences, and then we'll send you on your way. You know, this is such a wonderful product. This is a product that does require maintenance afterwards, just like your natural teeth required maintenance afterwards. So we still have to care for them. It's kind of gives, I always tell people, this is giving you a second chance. This is giving you a second chance to eat the foods you want, to go enjoy the activities you want again, because you know, dental implants are not a replacement for teeth. They're a replacement for people that don't have teeth or have failing teeth. 2 of my front teeth are dental implants. I can eat anything and function the way I want. This has been a wonderful service we offer people. And so we'll talk about kind of why us. There's a lot of people that claim they do this procedure, and a lot of people do it very well. There's actually a lot of people that don't do this very well. So how do you know which way to go or which route? And I don't care if you use us or our service, but you at least need to ask some very pointed questions when you're in your consultation with your provider. The first thing is, what type of materials do they use? You want to know what type of implants and what type of implant system they use. Here at Johnson Orofacial Surgery, we use implant systems, the top ones like Straumann, Nobel, Astra, and BioHorizon. These are all very well-known implants that have been around for years. This is important because if ever in the term, we want these to last for life, and 20 years down the line, if you have something that needs to be replaced, you want to have the parts and pieces and the longevity of that company to still provide the materials that you need to replace that. The second thing I would strongly urge you to do, I would avoid franchises and chains of people that advertise that they do this. The reason being is same thing with kind of the materials, is you want to use a surgeon that is going to be there for a while, that is stable, that isn't going to work at a place for a year and then move on to another location. You want somebody that's going to be familiar with you, that has your records. You want the same team in place. These are very complex surgeries. These are very complex procedures. You want a team that is used to working with the surgeon, that is used to the process, that knows what to expect, knows the level of quality that is expected of them. And so sometimes with larger franchises and chains, there's a lot of turnover. There's a lot of turnover with the surgeons, the doctors, the restoring dentists, the other ancillary staff. So just a word of caution with that. The other thing is just the process. Like I said, everything that we do is digital. A lot of people cut corners. They still do things with standard impressions or with analog, the way that they just send it to the lab to build the teeth. They're kind of set in just plastic teeth, the way they've been doing it for the past 40 years. This is not the way that I would want my teeth or my smile to be recreated. The cost too. Let's talk about the cost. This is an expensive procedure. I would rather somebody not get this done than to get this done to try and cut corners somewhere. There are a wide range of prices for this procedure. If you see, you know, there's a kind of a general cluster on what most people are trending. So get a couple different opinions as far as pricing. We're definitely not the cheapest. We're definitely not the most expensive, but I would be very leery on using a company that is substantially cheaper than the rest of the group, because they've got to make their business margin, and the way that they're going to do that is with quality, and they might not be using the same components, because this is an expensive cost that is then forwarded to you, but the lab costs are high, the implantable devices are expensive, and if you're going to go through this, you want this to be the top notch and the top quality, the best quality that you can have. And so I would always, you know, get multiple opinions, do your research either online, see multiple surgeons, get second opinions, and as always, we look forward to taking care of you at Johnson Oral Facial Surgery. Thank you.